The outpatient department in Medina opens on Wednesday and Saturday. The 2 days are the busiest in the base camp hospital. Doctors and soldiers prepare to receive patients as early as 6 a.m. Security checks are routine because of the risks associated with the visits. Mobile phones and smoking of tobacco in pipes are not allowed in or around the health facility because they are known for detonating deadly explosives. Before they lost strategic positions in Mogadishu, the Al-Shabaab attempted a number of times to launch mortar shell attacks at the facility in vain. Patients visiting this facility find themselves between a rock and a hard place. If caught by the militants, they will be subjected to punishment. Yet if they don't seek medical attention, they could die of disease. So they sneak their way in, avoiding roadblocks set up by the insurgents.
They actually have a fear. Even writing a prescription with paper headed with the AMISOM logo would provoke the insurgents to injure that patient, so they avoid carrying around these papers.
Every week, the AMISOM OPD center attends to at least 1,000 people. Special cases are usually referred to the main level 2 field hospital, where some 3,000 people have been admitted since 2007 and 2,500 of them operated on. 10 doctors from Uganda and Burundi are leading this humanitarian cause with the help of 2 Somali clinic officers. Bullet and bomb injuries form the biggest numbers of injuries presented at this facility, although fistula, an increasingly disturbing problem amongst Somali women, is also emerging as a major problem. Fistula could be common in Somalia because of the unattended birth. This complication is said to have caused several fatalities among the Somali women.
She's telling me she was operated yesterday. That was her second time. The first time they removed the uterus. So yesterday, again they removed some growth, which was growing in the cervix.
Ragay Muhammad could also have had her uterus removed if she did not seek medical help. She had her first child 2 years ago when she was 16. She delivered at home without expert help, and she lost the baby within 48 hours of birth. A few days after the birth, Ragay could not control her stool and urine, and the man to whom she was married abandoned her. This is just a tip of the iceberg of the agonizing experiences Somali women go through here. A section of this hospital is used to treat government soldiers injured in operation zones. Dr. Chiengo thinks that very soon, they will require much more support because of the rising numbers of casualties.
I was a man who was supporting AMISOM mission.
Language remains a major problem.
I get normal sometimes.
Doctors cannot work without the help of translators. As a result, many patients cannot articulate well their health problems to the doctors and clinic officers. The children's condition here is another story altogether. Children suffer malnutrition, dysentery, diarrhea, and HIV.
Some of these people are staying in camps, and obviously in such places you don't expect a good environment. The houses themselves where they stay, maybe getting water is a problem.
The demand for health services is high. Doctors have to prescribe drugs for patients to buy from a few existing pharmacies in Mogadishu town.
They are sold and are available, and sometimes we even buy them from there. But the drugs don't treat the patient if they are not given the right disease, for the right disease. So the patients actually come for the service of us being able to make the diagnosis and treating them.
That was the facility run by the UPDF. Now, the Burundi soldiers too have their share of the burden. The Burundi contingent operates its outpatient department on Tuesdays and Fridays. Over 400 patients are treated here every week, majority of them children. Like Uganda, Burundi is also expanding its field hospital to be able to attend to more civilians.
Qui se montrent pas, qui se manifestent, qui sont manifestés par des ulcères.
AMISOM's mandate includes providing humanitarian aid to Somalis. As combatants advance to capture new places from insurgents, another team follows to establish safe water points and to encourage people to visit the hospital. Frank Walisimbi, NTV.
Somalia.